Hello friends. So today's topic is breastfeeding and breast milk. So the breast milk is best food that we can offer to an infant from birth till 6 months of life. It contains all the nutrients which are required for the proper growth and development of the baby till 6 months of life in proper amount, in proper quantity, right? And it's been said that exclusive breastfeeding, we are going to talk a lot about exclusive breastfeeding in this lecture. So it's been said that if we achieve this target, that we exclusively breastfeed every single child till 6 months of life, so it is the most effective public health intervention. It is the most effective public health intervention to reduce neonatal mortality as well as under 5 mortality. Such a big thing. Please remember this point, that exclusive breastfeeding for 6 months is most effective public health intervention to reduce neonatal mortality rate as well as under 5 mortality rate. So they say that it can reduce neonatal mortality by 20%, it decreases neonatal mortality by 20% and under 5 mortality by 13%. It can decrease neonatal mortality by 20% and under 5 mortality by 13%. इतना important topic है, बहुत ध्यान से पढ़ेंगे, बहुत public health value का topic है and it's very interesting also. If we understand the basics, again we are going to read a lot about anatomy of breast and physiology of the breast tissue, what are reflexes which are involved in the secretion of the milk. So we are going to read everything in detail. So we will read exclusive breastfeeding, we will talk about exclusive breastfeeding, then we will talk about anatomy of the breast, then we will talk about physiology, and in physiology we are going to talk about what all reflexes are present in mother and what are reflexes which are present in the baby, the rooting, sucking, swallowing reflex, mother में prolactin, oxytocin reflex. Then we will read about technique of breastfeeding. What is the proper position of mother, what is the proper position of infant, how to attach the baby on breast, all these we are going to cover in this lecture, right? So first let's begin with exclusive breastfeeding. So what is exclusive breastfeeding? Exclusive breastfeeding means to give only breast milk, and nothing else. So exclusive breastfeeding means only breast milk should be offered and nothing else. What can be given? So if they ask what can be given, vitamin drops. So we all know from the lecture of rickets that it is because breast milk is deficient in vitamin D, so every single child who is on breastfeeding should be supplemented with 400 international units of vitamin D every day till their first birthday. So vitamin D drops, any vitamin drops which are required for the baby, and medicines if required. So these can be given. What not to give? Sometimes we confuse that the child may require water. Water is a big no, because breast milk contains 88% of water. So the water content of breast milk is 88% and it is sufficient to quench the thirst of the baby even during the hot summers. So water is not required. Any sort of pre-lacteal feeds, like sometimes we give formula milk. So we think that because mother feed is not sufficient, initially mother produces colostrum which is thick and comes in very less amount. So we think that this is not sufficient for the baby and we tend to give formula to the babies. But Initially, the stomach of the baby, the capacity of stomach of the baby is very small, and the colostrum, 1 or 2 drops of colostrum that the mother is producing is sufficient for the baby. So pre-lactal feeds में formula नहीं देना है. Formula is a big no. Then sometimes culturally, because of they say that because of cultural and religious reasons, honey, any sort of ghutti, so these all should not be given. So water should not be given, formula milk should not be given, any other pre-lactal feed like honey and ghutti or any medicine should not be given, herbal medicine should not be given. So breastfeeding should be started, exclusive breastfeeding should be started, initiated at birth. It is initiated at birth. At birth. It should be initiated, to be more precise, within 1 hour of birth. Within 1 hour of birth. It should be initiated within 1 hour of birth. Should be exclusive for 6 months, and after that mother can continue. It can be continued till 2 years or later. So if the mother is comfortable, she can keep on giving the breast milk to the baby beyond 2 years also. So for the first 6 months, we have to, for the first 6 months only breast milk. Then it should be continued till 2 years. But after 6 months, we have to give solids also. So solid food should be introduced at 6 months of age. But along with solid food, breastfeeding should be continued till 2 years or later. Understood? I think everything is understood in this slide. So exclusive breastfeeding means only breast milk has to be given. We can give vitamin drops, and if any medicine which is recommended by doctor, then it can be given. What not to give? Water is not needed. Water is not needed for exclusively breastfed baby for the first 6 months of life, because the water content of breast milk is 88%, which is sufficient even during the hot summer season. Pre-lactal feeds like formula feed should not be given. Honey, ghutti or any herbal medicine should not be given. Breastfeeding should be initiated within 1 hour of birth. It should be initiated within 1 hour of birth. Should be continued exclusively for 6 months, and beyond that till 2 years of age or till the time mother is comfortable offering breast milk to the baby. But after 6 months, child should be offered solid food as well along with breastfeeding. Now coming to anatomy of the breast. If we look, so this beautiful diagram has been taken from our very own Ghai. So breast tissue has mainly glands, milk glands. So what are milk glands? There is a sac, and then surrounding that sac there is epithelial cell which form and secrete breast milk, and then surrounding this there are myoepithelial cells or muscle cell. This is myoepithelial cells, all muscle cells. Okay, so these milk secreting glands, as you can see in this picture, these milk secreting glands, what they do, they secrete milk inside this sac. Right? And then there are multiple sac like these in the breast, and then from this sac a duct originate. This duct is known as lactiferous duct. So this duct is known as lactiferous duct, and it opens at the nipple. But before opening at the nipple, at the level of areola, or you say just at the junction of the areola and breast, where areola and breast tissue का junction है, at that point it dilates it dilates to form lactiferous sinus. Lactiferous sinus. Lactiferous sinus. So as you can see in this picture, that these are the milk glands. These are the milk glands. Okay, so there is a sac, and then milk secreting epithelial cells, and then surrounding that there are myoepithelial cells. Milk secreting cells or epithelial cells, they form and secrete milk inside the sac, and these myoepithelial cells, then they contract and they push the milk towards these ducts. So numerous lactiferous ducts arise from each gland, and they end at the level of nipple. And before opening at the nipple, at the point where the areola, so if you look at the breast from front, so there is a nipple. Nipple is the bulging structure, and there is the darkened structure around nipple, which is known as areola. Understood? So this is nipple and this is areola. So at this point inside breast, where the areola is meeting with the rest of the breast, these lactiferous ducts, which are coming from the milk secreting glands, they dilate and they form lactiferous sinuses. So when these myoepithelial cells, which are present surrounding the epithelial cells, when they contract, they push the milk and the milk gets collected inside these lactiferous sinuses. From different ducts, it gets collected inside lactiferous sinuses, where it is stored. So now when the baby is going to suck on this region, when the baby is going to suck on this areola, then the baby can draw milk from lactiferous sinuses, where the milk is stored. So understood? This is very important to understand, because what happens, अगर attachment proper नहीं है, if there is incorrect attachment and the baby is sucking only on the nipple, only in this region, baby is not going to get any milk, because all the milk is stored in the region of areola. So it is very important the whole of the areola should be inside the mouth of the baby. So that is the entire point of explaining this much in this diagram. Please remember that the breast tissue consists of glandular tissue, and this glandular tissue is supported by other supporting tissue as well as fat. So glandular tissue has a sac-like structure in the middle, and then it is surrounded by milk secreting epithelial cells, which is further surrounded by big myoepithelial cells. From sac, lactiferous ducts originate, and these ducts at the level of where the areola joins with rest of the breast, they dilate to form lactiferous sinuses. Inside lactiferous sinuses, milk is stored, and when the baby sucks on the areola, then only the milk goes inside the mouth of the baby. If the baby is suckling only on the nipple, the baby will not get any milk, because all the milk is stored at the level of areola only. I hope this is understood. Now coming to physiology, so the entire process of breastfeeding consists of two processes. So there are two processes are involved. थोड़ा सा previous slide में भी हमने discuss किया था. The first one is milk secretion, milk formation or milk secretion. And the second process is milk ejection. So in secretion, what is happening? In milk secretion, the milk is getting secreted inside this sac. Inside this sac from myoepithelial cells, the milk is getting collected inside this sac. And what is happening in milk ejection? In the process of milk ejection, the milk from this sac is coming and getting collected inside lactiferous sinuses through lactiferous ducts. Understood? So there are two processes, the process of milk secretion and the process of milk ejection. Now these processes are controlled by hormones. So they are under hormonal control. The milk secretion is under the control of prolactin hormone, whereas milk ejection is under control of oxytocin hormone. Now these two hormones, both of these hormones release from pituitary gland in brain. So prolactin is released from anterior pituitary, whereas oxytocin is released from posterior pituitary. Understood? Now there is a easy, see, every single point is important. ये सारे के सारे एग्जाम में पूछे जाते हैं. प्लीज़ रिमेंबर, इसको याद करने का एक निमोनिक हमारे टीचर्स बताते थे. सो देयर इज अ निमोनिक टू रिमेंबर दिस, दैट P for production. So milk production is under control of prolactin. Again P. And O for oxytocin. So oxytocin controls oozing of blood or ejection. Oozing or ejection, same thing, right? Oozing. So please remember P for prolactin and P for production as well, and O for oxytocin and O for oozing. So the process of milk secretion is under prolactin control, whereas process of milk ejection or oozing of the blood is under the control of oxytocin hormone. The prolactin hormone releases from anterior pituitary, whereas oxytocin releases from posterior pituitary. And what these hormones, they get secreted in blood and they reach the breast where they act. So what they are going to do? Again, the prolactin hormone is going to work on milk secreting cells. So it will work on milk secreting cells and it will enhance the production as well as synthesis and secretion of milk inside the sac of the milk secreting gland, right? So prolactin hormone is secreted in the blood and it enhances the secretion of the milk, and whereas the oxytocin hormone, it acts on myoepithelial cells. It makes them contract and then it is responsible for milk letdown. So when the milk comes inside these lactiferous sinuses, the mother feels that the milk is coming, filling up in the breast, right? When it is inside the sac, mother cannot feel it. But when the milk comes inside lactiferous sinuses, the mother feels that the milk is filling in the breast. So this is also known as milk letdown, milk oozing, ejection or letdown. All these are synonymous. Milk letdown process कहते हैं, milk letdown reflex. Oxytocin, it is mediated by oxytocin. So जैसे कहते हैं दूध का उतरना, बहुत सारा mother will feel that the breasts are filled and the milk is collected inside the lactiferous sinuses. So here in this diagram we can see how prolactin reflex actually works. So what happens when the baby sucks on mother's breast? So there are nerve endings in this region. So the breast is very richly supplied by nerves. Nerve supply of the breast is very rich. So nerve endings present at the region of nipples and areola, they send sensory impulses to the pituitary gland inside the brain, where prolactin is released. And please remember, now these all diagrams has been taken from our ghai only, and they are very beautiful diagrams. What goes wrong? We fail to read them. We fail to understand the diagram. See, it is written secreted after feed to produce next feed. So during the current feeding season, when the mother is feeding the baby, the nerve ending present inside the nipple and areola region, they are sending this signal to the brain that now the milk is going out, the lactiferous sinuses are getting empty, so we need to produce more milk. So it is secreted after feed to produce next feed, right? Prolactin में when the mother is feeding the baby, when the mother is done with the feeding, the prolactin hormone will go inside the milk secreting cells and tell them to produce further milk. So then when it is produced, the prolactin comes inside the blood and it goes in the breast tissue, and where the milk process, the formation of milk starts. So please remember that prolactin is secreted after the feed to produce the next feed. Now few important point about this reflex, that suppose the infant is sucking slowly, very slowly, so the less signal will be sent and less prolactin will be released in the blood and the milk production will be low. So if the infant is sucking very vigorously, more signals will be sent to the pituitary gland, more prolactin will be secreted and the milk secretion will be more. So more demand, more supply. So this is demand supply reflex basically, more demand, more supply. So the infant only will tell the mother's body that how much milk to be produced. More demand, more supply. It works like this because ये suckling से start होता है, then it goes in mother's mind and then the prolactin is secreted and the prolactin will act on breast tissue. So more the demand, point number 1, more the demand, more the supply. Earlier the initiation of this reflex, sooner the reflex, sooner this reflex will be established. And the third point is, prolactin is secreted more during night time. Prolactin is secreted more during nights. You can see a moon, right? You can see a moon in this diagram, a beautiful diagram. So it means that prolactin secretion is more during night as compared to day. Understood? So 3 important points about this reflex. Point number 1, more the demand, more is the supply. Point number 2, earlier the initiation of the breastfeeding, sooner the reflex establishes. Point number 3, prolactin secretion is more during nights. This tells the importance of night feeds. Night feeds are very important because night feeds, prolactin is secreted more, so the more milk will be available for the next feed. And the entire reflex, I hope you have understood. When the infant sucks on the mother's breast, the nerve endings which are present inside the nipple and areola send the signal to the mother's pituitary, from where prolactin is secreted inside the blood. Through blood it goes inside the milk secreting cells of the breast tissue, where it tells the breast to prepare milk for the next feed. This is the entire reflex. More demand, more supply, secreted more during night. Earlier the initiation, sooner this reflex will establish, and easier will be the establishment of breastfeeding. Now coming to oxytocin reflex. So oxytocin reflex is basically oozing reflex, right? So oozing reflex आपके हिसाब से कब act करना चाहिए? At the time when the infant is feeding or before it, right? It should be before or during the feed, because now milk is already formed inside the milk secreting cells inside the sac, but now the baby is going to require the milk, he is going to suck, then so the milk should be available to this baby. So the milk should be sent from these sac to lactiferous sinuses. So what happens when baby starts suckling? when baby starts suckling, again because there are so many nerve endings at in the region of nipple and areola, it sends sensory impulses to pituitary gland. From posterior pituitary, oxytocin is released. And now all the milk which was present, oxytocin will work on myoepithelial cells. Remember this diagram. So in this diagram, there were epithelial cells or milk forming cells on which prolactin was acting, and there were myoepithelial cells, bigger myoepithelial cells surrounding them, on which oxytocin was acting. Oxytocin will make them contract, and that will result in milk let down. So all the milk will come inside the lactiferous sinuses. Now baby can suck on this milk, and the milk will go inside the mouth of the baby. Now oxytocin reflex, how does it work? So whenever the mother is going to start the session, so the thought of the baby, the sight of the baby, the smell of the baby, even thinking about the baby, all these stimulate oxytocin hormone. All these emotions, mother's emotions, they promote the secretion of oxytocin from the posterior pituitary, and it acts on myoepithelial cells to ooze for the milk let down, oozing of the milk inside the lactiferous sinuses, right? So if the mother, before we read this thing now, that oxytocin reflex works before and during feed. So before, when the mother is thinking lovingly about the baby, sound and sight of the baby, and confidence plays a very important role. So oxytocin, when the mother is full of confidence, mother is relaxed, then oxytocin secretion is increased. If the mother is in doubt, mother has low self-esteem, mother has a lot of stress, mother has pain, so all these conditions, they hinder in this reflex. Oxytocin will be decreased. So please remember, this is very important, and it has been asked several times in exam as well, that the sight, the smell, the thought of the baby, the confidence and relaxed attitude of the mother, all these things, they promote the oxytocin reflex. Whereas stress, worry, if the mother is having pain somewhere, lack of sleep, lack of confidence. So if any of these features are present, then oxytocin reflex is hindered and the milk letdown will not be sufficient. Now talking about reflexes in newborn, let's read reflexes in newborn. So what are the reflexes in newborn which are responsible for the breastfeeding, helpful in breastfeeding? So there is rooting reflex. Then there is sucking reflex, and then there is swallowing. So what is rooting reflex? So what happens whenever the cheek or the side of the mouth or even the upper lip of the mouth or anywhere around the mouth, the baby is touched, the baby turns his or her head towards that side, opens the mouth and actively searches for breast. This is rooting reflex. When the cheek, side of the mouth or upper lip of the baby is touched, baby turns his or her head towards that side, opens the mouth and actively searches for breast. This is rooting reflex. So if you want to see a video, please let me know. Let me leave a comment. I'll put a video on my YouTube channel. So if the baby's mouth is touched, area around the baby's mouth is touched, area around the baby's mouth is touched, what does this infant will do? It will open the mouth, turn the head towards that side, turns the head, opens mouth, and searches for breast. So you will see this reflex is so strong in term newborn. Even you have seen a normal newborn, you will see anything kept, either you touch or you keep anything, it may be, the cloth of the baby as well. The child will look at that side and then he or she will start looking for breast. So this is rooting reflex. When the side of the mouth or the cheeks of the baby are touched, then the baby turns toward that side, opens the mouth and actively searches for breast. What is sucking reflex? So what is sucking reflex? So now the baby has find the breast. It is inside his mouth. So when the baby's baby's palate has been touched. So baby's palate, nipple touches the palate. Say nipple of the mother touches the palate. Nipple touches the palate. What will the baby do? Baby will start sucking. So it will grasp nipple between palate and the tongue, and then it will squeeze it between tongue and palate, and it will draw the milk from the lactiferous sinuses. So when the nipple touches the palate, when the nipple of the baby touches the palate, it squeezes the breast between palate and tongue. Sucking में क्या होता है? Sucking में क्या होता है? Baby will squeeze nipple between his palate and tongue, and he will draw milk from lactiferous sinus. So after sucking reflex, the milk is inside baby's mouth, right? The milk is inside baby's mouth. Now baby has to swallow it. Baby has to swallow this milk. So swallowing reflex. So after few gulps, after sucking for few times, suck, swallow, suck, swallow. So after sucking a few times, say 2 or 3 times, baby will swallow it. Baby sucks for few times and then swallow. So effective sucking and swallowing needs coordination with breathing, right? Even for us, when we are drinking water, we need coordination with breathing, right? So rooting is important, sucking is important, swallowing is important, and sucking, swallowing, coordination with breathing is important. So this one cycle of sucking, swallowing and breathing, it takes around 1 second. Now there is a term we use in bottle fed babies which is called as nipple confusion. From this slide you can see that the baby taking breast milk is a quite quite fine process. It is a very well coordinated, so many reflexes are involved, and then baby is able to find the breast, put it inside his mouth, then suck it, and then following sucking, swallow it. So it is a quite beautiful process, quite complicated process. So when we offer bottle to the baby, what does baby do? So bottle mein there is free flow of the milk. All baby has to do is to control the flow so that he can coordinate it with breathing. So it is a passive process. Bottle feeding is a passive process because from bottle the flow of the milk is continuous, and all baby has to do is to control the flow of the milk. So because of bottle feeding, nipple confusion arises. So once you give bottle to the baby, baby will start forgetting all these reflexes, all these beautiful reflexes. The baby will start forgetting these reflexes. Then the breastfeeding will be, to establish breastfeeding will be very difficult. So this process is called as nipple confusion. Please remember, bottle feeding is a passive process, whereas breastfeeding is a active and a complicated process. So if you give bottle to the baby, baby will forget all the reflexes and breastfeeding will be very difficult for that baby. Now coming to technique. Now we will talk about a session of the breastfeeding, how the mother will sit, take her infant in her arms and feed the baby. So there are two things. First is position of the mother. We will talk about position of the mother. What should be the position of mother while breastfeeding? What should be the position of infant? And then we will talk about attachment. So what should be the position of the mother? What do you think? Can a mother feed her baby while lying down? Can she? Yes, she can. So mother, please remember that mother can feed the infant in any position she is comfortable. She can feed in lying down position, or if she is comfortable, she can feed while sitting. So both the positions are okay. There is no problem. There are only two requirements, that the back of the mother should be supported and she should not lean over her infant. It should not be like this, that mother has kept infant on her lap and then she has to lean, right? I'll show you some beautiful pictures which has been given in Ghai. बहुत अच्छे से explain करती हैं what should be the position of mother. So the back of the mother should be supported. Only two requirements in the position of mother. Back of the mother should be supported and she should not lean over infant. She should not be leaning over the infant. She can feed the baby in any position she is comfortable. She can feed while lying down or while sitting. So as you can see in this picture, now see in picture number 1, she is supporting the baby with her legs, with her thighs, so that she doesn't have to lean, right? She doesn't have to lean over the baby and the back is supported. So that way she can keep the baby over her thighs, fold the legs like this and hold the baby so she doesn't have to lean over the baby. In picture number 2, you can see the the mother is using a nursing pillow. So what mother can do? Mother can take a nursing pillow and keep the baby infant over that, so that she doesn't have to lean over the infant, right? So back is supported and she is not leaning over the infant is the correct position. In this picture number 3, you can see the mother is lying down. Mother is lying down, but her back is supported with the help of pillow, and she has kept infant also in a way that she doesn't have to lean over her. She is lying down in a very comfortable position. So mother can feed the baby in any position. She should not, her back should be supported and she should not be leaning over her infant. So these are the only two requirements, explained with the help of very beautiful pictures given in Ghai. What should be the position of the baby? First, the whole body should be supported. It should not be like that you have kept the baby's head over your arm and the entire rest of the body is dangling or hanging, right? It should not be that. So whole body of the infant should be supported, not just the neck of the baby. Point number 2, baby's head and body should be in the same line. It should be in the same line. It should not be twisted. It should not be like that you have kept the baby like this and then turned the mouth towards in one direction or towards mother breast. So head and body should be in the same line. There should not be any twist in the neck. So it should not be like ki body is like this and head is tilted toward this side. It should not be like this. The entire body should be tilted. ऐसे नहीं होना चाहिए कि आपने बेबी को ऐसे रखा है, बेबी को ऐसे रखा हुआ है और उसका हेड ऐसे करके ऐसे हो रहा है, ठीक है. Entire body should be tilted. I think if you are able to see my hands, so a mother is doing like this. So infant की body सीधी है and the head is tilted towards the breast. This is wrong. Entire body is tilted towards the breast so that the head and body are in the same line and neck is not twisted. Point number 3, very easy. Body should turns toward mother and the abdomen of the mother and the abdomen of the baby should be touching each other. Abdomen of the mother and abdomen of the baby should be touching each other. Point number 4, baby's nose should be at the level of the nipple. Nose should be at the level of the nipple. सामने होनी चाहिए बिल्कुल. Nose should be at the level of the nipple. You can remember with the help of a kind of mnemonic. It's a sort of mnemonic, you know. Breastfeeding workshop में, UNICEF वाली workshop में they used to tell us. So whole body should be supported means Sahara. So you can remember with the help of Sa. Hindi letter Sa. So Sa says Sahara. Whole body should be supported. Then head and body are in the one line. It means Seedha. Seedha. So they used to tell us that बच्चे का कान, कंधा, कूल्हा should be in the same plane. It should be in the same plane. कान, बच्चे का कान, बच्चे के ear, कान, कंधा and कूल्हा should be in same plane. So ear, shoulders and hips, they should be in the same plane. What I mean, head and body should be in the same plane. So this is Seedha. Then body turns towards the mother and abdomen of the mother and the abdomen of the newborn should be in touch with each other. Sampark. You can remember this line with the help of a single Hindi word, Sampark. And finally, last but not the least, Samne. The nose of the baby should be at the level of nipple. Nose, N for nose, N for nipple. Nose should be at the level of nipple. Sahara, Seedha, Sampark, Samne से आप याद कर लीजिए इसको. Whole body should be supported. Head and body should be in the one line. Neck should not be twisted. Body should be turned toward the mother. Abdomen of the mother and baby should be touching. And nose of the baby should be at the level of nipple of the mother. I hope this is understood. So after the position of the mother and baby is correct, then what will mother do? Mother will offer her nipple, keeping the nipple at the level of nose. She will offer the nipple. She will touch upper lip of the baby with the help of her nipple, and then rooting reflex. Because of rooting reflex, the baby will find the breast and put it inside mouth. Now you have to see whether the attachment, the way the baby is taking the breast inside her mouth is correct or not. So what are the signs of attachment? Baby's mouth should be wide open. Point number 1. यहाँ से यहाँ तक मुंह खुला हुआ है इसका. Baby's mouth should be wide open. Point number 1. Most of the nipple and areola should be inside the mouth. Only the upper part of areola should be visible and not the lower one. So entire the lower areola, entire nipple and most of the areola should be inside the mouth. Only small portion of upper areola should be visible and lower portion of the areola should not be visible. Baby's chin should be touching. See, you can see in this picture, baby's chin is touching the mother's breast. So the chin is touching mother's breast. Chin should be touching the breast. And lower lip should be everted. Not very good picture to see this, but you can see in many pictures that baby's lower lip should be everted. Please remember these 4 points of good attachment. First, baby's mouth should be wide open. Most of the nipple and areola should be inside the mouth. Only a small part of upper areola should be visible. Lower part of the areola should not be visible. Baby's chin should be touching the mother's breast, and then lower lip of the baby should be everted. If you have some confusion, you can remember this with the help of mnemonic calm. So I made these mnemonic during my MBBS and NEET-PG preparations because बहुत सारी चीज़ें हमारे पास बहुत अच्छे टीचर्स नहीं थे and we were not able to understand a lot of things. So हमने रटने पड़ते थे. So C for chin should be touching breast. A for areola, nipple and areola should be inside the mouth. L for lips, lower lip should be everted, and mouth, baby's mouth should be wide open. So you can remember the mnemonic calm, CALM. This is for the time when you should try to, when you have plenty of time, you should try to understand everything. But sometimes what happens कि याद की हुई चीज़ें में recall नहीं हो पाती हैं. Then for those times, these mnemonics you should keep them in your store so that you can remember at the right time. So how will you know that the baby is sucking effectively? Now that you have seen that the position is right, the attachment of the baby's mouth on mother's breast is correct. So how will you know that the baby is sucking effectively? So you can see the movement of Adam's apple. You can see that the throat cartilage is moving, and then you can hear some gulping sound also. So when the baby is swallowing, you can hear the gulping sounds, right? So throat cartilage move कर रही है, gulping sounds you can hear, and you can see the cheeks of the baby are full. Cheeks, these are cheeks. Cheeks of the baby are full and not hollow and retracting during sucking. So baby will suck and then swallow, suck and then swallow, suck and then swallow, right? So that way baby is swallowing. So this is all for this lecture. Now composition of the breast milk and benefits of breast milk, all about breast milk has been left, and a little bit about the breastfeeding also left, right? What are the problems mother face during breastfeeding, like inverted nipples or sore nipples, cracked nipples, then not enough milk, conditions like those, storage of the breast milk. So a few points are left. I'm gonna take them in another lecture because I know 40 minutes से ज़्यादा की limit नहीं होती है हमारे mind की, so that we can concentrate. So bulky and difficult lectures, put you away from the topic, and short and concise lectures, they keep your interest alive in the topic. So that's all for today, and we'll see you in the next lecture. Thank you.